Have you ever wondered what causes gout? It's a question that has puzzled many. To understand gout, we need to delve into the world of inflammatory arthritis. Gout is a form of this condition, and it's marked by the deposition of uric acid crystals in the joints and surrounding tissues. Now you might be wondering, what on earth is uric acid? Well, uric acid is a normal byproduct of the breakdown of substances called purines. These purines are found in many foods we consume and are also produced naturally by our bodies. Usually our bodies do a pretty good job of managing uric acid. It dissolves in the blood and makes a swift exit through the kidneys, leaving our system via urine. But sometimes this process doesn't go quite as planned. Gout typically begins when there's too much uric acid in your blood. But why does this happen? Let's unravel this mystery together in the next scene. Gout develops in several key steps, beginning with an excess of uric acid in the blood. This excess, known as hyperuricemia, can occur due to two main reasons. Our bodies might be producing too much uric acid, or our kidneys, which are responsible for excreting uric acid, might not be doing their job as efficiently as they should. Now, uric acid is a usual suspect in our bloodstream. It's the byproduct of purines breaking down, which are substances we find in many foods, and also those that our bodies produce naturally. But when there's too much uric acid floating around in our blood, things start to get a little prickly. And I mean that quite literally. This surplus uric acid starts to crystallize, forming needle-like structures of something called monosodium urate. It's a bit like when you supersaturate a solution with sugar and sugar crystals start to form. Only, in this case, the crystals aren't so sweet. They have a tendency to deposit in and around our joints, especially in the cooler areas of our bodies. Once these urate crystals set up camp in our joints, they are seen as uninvited guests by our immune system. This triggers an immune response, leading to inflammation in the joints. Our immune system sends in white blood cells to the area, thinking the crystals are foreign invaders. It's a bit like calling in the troops for a battle. This causes pain, redness, swelling, and warmth in the affected joint. The sudden onset of severe pain and tenderness in a joint, often the big toe, is what we call an acute gout attack. It's like a red alert situation. But remember, gout isn't picky. It can affect other joints too, like the ankles, knees, wrists, and elbows. So that explains the process of gout formation, but what factors can increase your risk? Several factors can contribute to the development of gout. Let's explore them. Firstly, genetics can play a significant role. If gout runs in your family, you may be more susceptible. Secondly, your diet can also increase your risk. Consuming foods high in purines, such as red meat, seafood, and sugary beverages, can elevate uric acid levels. Thirdly, carrying excess body weight is associated with a higher risk of gout. Obesity can lead to increased uric acid production and decreased uric acid excretion. Certain medical conditions like kidney disease, hypertension, and diabetes are often found hand in hand with gout. Lastly, some medications like diuretics and low-dose aspirin can affect uric acid levels. Managing gout involves medications to ease inflammation and lower uric acid levels. Lifestyle changes like dietary modifications and maintaining a healthy weight are also crucial. Remember, if you experience symptoms of gout, seek medical advice for proper diagnosis and management.